Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Management of symptomatic fibroid. Management of symptomatic fibroid. The most common symptom in a fibroid is heavy menstrual bleeding. Submucosal fibroid. For submucosal fibroid, definitive management is removal of fibroid. Hysteroscopic removal of type 0 and type 1 fibroid can be done.
Type 0 and type 1 fibroids are removed hysteroscopically.
Intramural or subserous fibroid. Intramural or subserous fibroid starts with medical management. Myometrium.
thank you and thank you for watching.